my good friend Dr. Andrew Orden, and we are at the Aesthetic Show Live news desk, where we're going to be doing some great interviews this morning with some of the top aesthetic surgeons throughout the country. And I have this morning one of my very good friends, Dr. Andrew Orden.
Good morning. How are you?
I'm fantastic.
We've switched roles here. Usually I'm interviewing you on the doctors.
I know, it's unbelievable.
This is your audition. We're going to see how you do.
You know how you got on this. I was the one that actually gave them your name for this. How good is that?
I owe you an assist there. But you've always been great on the doctors. We always enjoy having you. You're cutting edge stuff. So let's take it away.
Well, you know, everybody wants to know about the history of the Aesthetic Show. Can you tell us? Because we know there's a long history there with you involved.
Well, there is. Who's counting? But I think it's like 8 years now that I'm the scientific chairman of the Aesthetic Show, and during that period of 8 years, I've seen it just grow and grow and grow. Obviously, it's a multidisciplinary type of meeting, which I like. Different specialties, but everybody has the same goal: to learn the newest in technology, techniques, tips, and trends. What I call the 4 T's.
It's true, and it's become super successful and popular because people from all over the country and world are coming here to learn the newest techniques from different surgeons of all different levels.
And you know, this meeting has a different flair to it than a lot of the other meetings, that it's not connected to a society per se. The dermatological societies or the plastic surgery societies, it's a meeting unto itself, bringing people from different disciplines, and I think that's what sets it apart.
Was that your original reasoning for this setup?
Well, you know, they had already set it up. It was like that. They brought me in as the plastic surgeon to add that twist, and sort of just to tie it all in together as the aesthetic or the scientific chairman.
How do you think this has evolved over time?
Oh, it's just growing, getting bigger and better and more complete, more thorough, better attendance, more exhibits. I mean, in every facet, we've sort of found a home away from home here at the Wynn now. I think it's 4 or 5 years, so I always look forward to coming back to the Wynn. Very comfortable, and they take good care of us.
What was the first meeting like?
You know, if I can think back there were still some things, some kinks that were being worked out, and it just wasn't as thorough. I mean, some of the original players that are still coming, some of the specialists that have always been a part of this group, were there, and they're sort of the forefathers, the pioneers, so to speak, of the Aesthetic Show. They're still here. They make it what it is.
That's great
today.
What do you think people come to the Aesthetic Show for the most? What are they looking for? The glitz and the glam, like you talked about, some of the celebrity.
Well, that's part of this show, is that we try to touch on that, the glitz and the glamour, that aspect of aesthetic surgery and aesthetic medicine. But you know, as I said, just the latest technology, and my lecture in a few minutes in the welcome session is keeping up with the competition. It's a seasoned veteran like me trying to keep up with the up-and-coming guys like yourself. And I'm going to touch on that. You know, I've been doing this 33 years. It changes all the time. I mean, back in the days, I'd run Yellow Pages ads and do that. Crazy. That doesn't work anymore. So, you know, touching on that, it changes all the time. And what we need to do as committed physicians, practitioners in aesthetic medicine, what we need to do to keep up with the trends and keep up with the competition.
What do you think the other doctors and consumers are looking for now? Are they looking for the same things they did 10, 20 years ago, or has it just changed the way in which we give that to them, or are they looking for something new?
Well, I think people have always looked for the same thing. They want to look better because when they look better, they feel better, but it's just gotten so much more elaborate. There's so many different options, so many different steps that you can take as part of that journey. It's gotten a lot more complex. So we here at this meeting, next few days, we're going to address each one of those components.
Yeah, that's great. And that's, I'm sure, what you were talking about, keeping up with the competition. nowadays everyone can see everything.
Can we do a selfie now?
I would love to do a selfie. Make sure you tag us.
That'll come later.
Make sure you Insta tag us. Make sure you hashtag us, because that's what's happening nowadays. People can see things instantly. They want to see results. They want to hear what the newest trend is, and if it's not through their scroll, it's past them.
Exactly, and that's the way they're checking you out. Is this guy legit? What kind of results is he getting? Are his patients happy? And I'm going to touch on that during my session, keeping up with the competition. That you have to be social media aware and optimize and use that and use that internet and all those things.
There's no more yellow. I don't even think people know what the Yellow Pages is anymore.
No, it worked for me back then.
No, I'm sure it did.
I mean, those Yellow Pages worked. I mean, I always tried to keep up with the competition, and how I did that, I tried different things, print and radio and things like that. And in my Palm Springs office, we actually do a billboard, which works in that market. I mean, different things work in different markets. I wouldn't do a billboard in LA. I hear somebody just recently put one up on Sunset, plastic surgeon.
Yeah.
I have no clue how much that costs.
Well, I know a couple plastic surgeons that have all of Olympic. You go all the way down to Olympic.
With billboards?
Every third billboard is theirs.
Really? Well, you know, maybe they got the idea from us in the desert. In the desert it works, but.
Yeah, what do you think? What do you think is the most important thing for patients that they want to look at and see before to find you, or to go to you?
Well, I think
aesthetics, not just you. You know, in general.
Well, I think we have found. You know, you can do all this elaborate stuff on your website with your great credentials and talk about how wonderful you are. I mean, sure, that's a given. You want that to be part of the overall package, but they want to see results.
Yeah,
they want to see before and afters. And I'm going to touch on that during my talk, that you want to bring them into the process. You want to make it personal. You want them to become part of your family, that
I agree.
that you and your staff care about them in their initial treatment, but then ongoing treatment.
Yeah, lifelong.
Form that partnership, and if you do a good job of that, that's going to translate to sending you more patients. And that's still, I think we all agree, is the single best way to enhance your practice, grow your practice, get more patients, is through happy patients and word of mouth.
Yeah, I think that's what I was trying to get to, was that has never changed. The word of mouth, the local branding, the success through great before and afters has never changed, but now how people find those things and see those things has expanded dramatically.
Exactly, and some of these back in the day when I was competing with the big names in New York City, the Dan Bakers, Sherelle Astons, you know, we would never advertise, but of course they had huge PR things. They did it in a different way under the guide, oh no, it's not advertising. Well, they made sure that they did certain things to get their names out there, and you know, it just continues to change.
Yeah, so it's great. Well, it was wonderful having you here.
We're not done, are we?
Yeah, that's how easy our talks are. We're just such good friends that it just flows.
It's always a pleasure.
I know. Is there any takeaways that people should take from you before going to see your morning session?
Well, it's just the meeting gets better and better each year. I'm excited to be here, excited to see colleagues, friends like yourself, and a lot to be learned here.
Great.
In the next few days.
Well, thank you for having me. It's always a pleasure. Feel very privileged and honored to know you. Great man.
Thank you.
Thanks so much. Good luck today. So that was having Dr. Orden here this morning. Go see him in his morning lectures. And up next, we have Richard Goldfarb to talk about our the hot new topics of male aesthetics.
Yo, Las Vegas, Nevada. I'm Dr. Joe Nyamtu, coming to you live from the 2018 Aesthetic Show. You can hear a lot of noise back here. We have an injectable clinic that's going to be going on in a couple minutes, and we have probably doctors from about every specialty you can imagine. We have nurses, we have auxiliary staff, all learning how to make people beautiful. And today we have a guest who's got a ton of energy, okay? Dr. Rich Castellano from Tampa, Florida. He does facial plastic surgery, but he does so much other stuff, and I don't know how we're going to pack it all into 15 minutes. So Rich, let's start out. Tell us who you are and what you do.
So excited to be here, to be with Dr. Niamtu. Oh my gosh, what an inspiration. The career you've had, the things you've done, the videos, so true honor to be here. Thank you for interviewing me.
Thank you.
And we're just here to have fun. That's what we do. So we help people look younger. As a facial plastic surgeon, I discovered none of our treatments look as good as Mother Nature's free facelift when we smile. So I love doing facelifts under local anesthesia. I love doing facial fillers. We do a lot of them. I do a couple hundred syringes of filler every month. I was very proud to win the Aesthetic Show Award a couple years ago. And now we help other doctors build their practice. So that's what I'm here to do.
And so tell us a little bit about this. This guy's got a lot of supplemental material here. So you teach courses, and I want you to talk about what you're teaching and then address the little smile deal with us too.
Yes, all right, so we have an online coaching and mentoring program. We give 9 hours of CME for that. And then I have a live event which is coming up, mark the date. It's October 26th through 28th. We're gonna give over 21 hours of CME, and we teach doctors the business practices. So what we're teaching is, last year, I'm the only provider, we did over 3.4 million in cosmetic revenue. This year we're up 40%, no insurance. So how do I do that? We teach it, and they can get CME credit for that. Tons of doctors, rave reviews, so proud of our doctors getting wonderful results. So whether they need it live and in person or online, we're doing them both. And that ties into our little smile score, 10 out of 10 smiler. You know, a lot of doctors out there, they don't smile so much. We're here to help people feel good. We care about them.
A smile could get you a long way in just about everything.
It gets you everywhere.
Yeah.
But doctors, they do all their training and studying and everything, and then they show up, and it's about emotional literacy, right? When we're good communicators, it means everything. And doctors are burning out at record rates. I'm a part of the Hillsborough County Medical Association Physician Wellness Program. We did a training out of MacDill Air Force Base. So our goal is to raise the awareness, raise the communication skills. So that's what we're here to do. Talk with doctors, find out where their challenges are, and get them to the next level.
And you know, it's interesting because there are a lot of doctors who are very well trained, they're very smart guys and girls, but they really don't have the personality part of this, unlike Kian Karimi right there, who's got it all. But so sometimes you've got to teach a doctor how to be happy and how to be energetic, right?
Absolutely.
And you can have the opposite, where you have somebody that's really a good people person, but they're not that good of a doctor. It's going to be harder for them to succeed than it is somebody with skills who you can kind of coach into personality skills. You see that a lot? Do you see people that are kind of shrinking violets and you kind of inspire them and get them out of their shell?
It's a great question. So we see it all. Mostly you see doctors who are very skilled, very educated, but not great communicators. If you're a great communicator and you really care, you will develop those skills. It's just inside of you. You want to do well for other people. So now you can measure it. You know, is the doctor a high, a middle, or a low smiler? Is your patient a high, middle, or low smiler? If we do a cosmetic consultation and you cannot get that patient to smile through the entire consult, what's the likelihood they're going to smile after we do our very best work?
Yeah.
It's low. You got to screen these people out, but we do it ourselves. When you share that, you're just showing that you care. You're communicating effectively, and when you measure it, the smile score matters. Some people will say, well, I know how to smile. You want me to smile more? No, it's about smiling authentically, showing you care, practicing it. That's what we help doctors do.
No, that's awesome. And when you talk about doing consults, we're sitting there and we're evaluating that patient mentally, physically. They're sitting there, they're evaluating us as well. And so, some people, you touch them and they're sweating because it's uncomfortable for people to go into and talk about their imperfections.
They're scared.
And people with good personalities and the staff too, right, can relax them and get them going. But it really bothers me when I can't get somebody to smile. And the harder you try, and you have some people that are going to be good patients. They're not happy or they're not smilers. And you have some people that's such a red flag that that you probably should just tell that patient you know, you probably can't make them happy. How do you, I find one of the hardest things, especially when I was first in practice, is to say no to a patient. Do you come across that often?
Well, it's rare that you have a patient that's a true low smiler and their personality is just not a good fit. As much as we want to help other people, you can't save the whole world all the time right now. So sometimes it's the right thing to tell a patient to say, you know, we can do this for you, but now's not the right time. Let's get through some of these things, or just telling them, I don't think this treatment's going to give you enough improvement to make you happy. I just want you to be happy.
Yeah, yeah.
Right? And if you phrase it that way, you're being an advocate for them. Let me send you to this person,
yeah.
maybe they can help you, but this isn't going to help you. I just want you to feel good. And if they can't feel good about themselves before, yes, we help them do better, but they have to have a foundation to build on.
Yeah, and you know, I think we all have our own ways of handling that, and sometimes I'll tell people that, I'll say, look, I really want to be honest with you. I think you're a fine person. I don't think I can meet your expectations or the precision that you want. What are some red flags? Besides, not smiling is a big one, not making eye contact. What are some other red flags? You know, if you were talking to doctors, especially young doctors, things to watch out for in a prospective patient that might end up being a nightmare.
So I like to simplify everything. Really, it's the smile. If I can get somebody to smile, we'll get along fine. Even if their expectations are way out of control and they're smiling, I say, you know what? Listen, I'll tell you what, I'll just give you a whole new face. How's that sound? And we're joking and laughing, and we can still get going. If they can smile, if they don't take themselves so seriously, it'll work. For me, it's the smile. It's about a relationship. If we can build a relationship, you can make something happen. If you can't build a relationship with someone, if you're getting the wall, if the wall's up too high, don't do it. Everything worthwhile starts with the smile. So it's just...
Everything worthwhile starts with a smile. So we only have less than a minute here. You know, I think that so many patients have had the bad experience of being with stuck-up, egotistical doctors that they can't talk to. It's, you know, I give everybody my cell phone. I'm sure you probably do too.
I do the same.
And I think that it's, you know, people say, well, how'd you get successful? Say, by being a nice guy and by smiling. So in 30 seconds, if you had to tell young doctors 3 things to do to be successful, what would it be?
It's about kindness. It's about respect for the patients, for yourself, for your team and your staff. Come and get trained October 26th in the Tampa Convention Center. You're going to get CME credit. Come out, live event. It'll change your life. It's like nothing you've ever seen. Or do our online coaching and mentoring program. Tons of happy doctors. We can teach them how to do it.
Well, that's excellent. And you know, one of the great things about being at the aesthetic show is to meet so many dynamic people, and this is one of the big stars here. Thanks for being with us, Rich.
Thank you, appreciate it. It's an honor.
Thank you, Las Vegas, the Aesthetic Show 2018, and this is a wrap for today. I'm Dr. Joe Nyamtu. Thanks for tuning in. I'm Dr. Ron Burgundy.
Interview on male aesthetics, and we're now here with one of my favorite injection experts, Lori Robertson, and you have to make sure to follow her online because she has amazing things on her Instagram and her Facebook at Injection Expert. Lori, we're here today to talk about fillers.
We are. Thank you, Jason.
That's one of your specialties, right? Tell me about how you got into injecting fillers.
It is. It's kind of a long story. I was doing family practice for a few years, and actually, it kind of perked my interest. I went to go get Botox somewhere and looked around and said, wow, this would be kind of a nice place to work. So I started looking into it and actually kept both family practice and aesthetics for about 9 months until I let family practice go, and it's become my passion. Never thought after 30 years of nursing that it would become my passion. Yeah. So I love it. I love it.
Well, that's the thing about fillers, you know, anybody can take a syringe and inject a wrinkle or a fold and get a little bit of a plump, good or bad, right?
Right.
But very few people can take a face and aesthetically make it more beautiful without anybody knowing. And that's the artistry and kind of the skill. Tell me how you feel about that, because you obviously have that eye, you have great skill and artistry when it comes to doing fillers, and why you're busy and people go to you. How do you do fillers differently than others?
That's a tough question. It's a tough question because people ask me, or they say, well, you are so artistic. And the first thing I say is, I draw stick people. You know,
I'm the same.
I don't feel like I'm artistic. Okay, good. You're an artist.
I cannot
what you
draw
do.
a single thing, but
So-
I can see it when I look at somebody.
Exactly, and we get it. We get anatomy, we get facial aging, we get the whole process. So when we know what happens with the aging process, we know what to do to replace things that have been lost throughout the years.
That's
So
true.
we look at it more as kind of sculpting. I don't look at it as artistry, I look at it as more anatomy, physiology. I look at it from a different eye, from a different perspective, because like I tell my patients, I draw stick people, but I get the face, I get the aging, I get it. And it just falls together. It just falls together.
But that's why people will go to you. They see that not only are you passionate about it, but also you understand what's occurring during that process and can look at them differently than just treating a condition. You're preventing things from happening.
Exactly.
Because if someone loses volume in their face, we're using fillers to revolumize. But if you're getting somebody younger and they haven't lost volume in their face, how do we prevent the areas that are going to lose volume from losing the volume?
Well, it's a really good point, because what I do when I have real young people who want to do things that maybe fillers that would not be beneficial for them, I say no a lot. I do.
That's good.
I let them know that if you're young and you want to do a lot of fillers, it really makes you look older sometimes.
That's
and
true.
done.
That's
and
true.
my goal is to really help people look rested and not done. I don't want people to know, I don't want anybody to know that I've done something with them.
That's great.
So as long as somebody can't recognize my work, as long as it's invisible, I'm happy.
That's great. You know, it's funny, there's a double-edged sword, because you want people to know that they went to you, but you don't want to let them have others know that they had something done.
Right.
So it's kind of hard. Otherwise, they just have to, you know, you don't want someone to look at somebody and think that they had fillers.
Exactly, and that's why I tell my patients, I go, don't be upset if somebody doesn't notice, oh, you got your cheeks done. I go, listen for the comments about your skin looks really good, your hair looks great, or you look great, did you do your hair differently? Listen for those comments, and I put that in my patient's mind, so they kind of are perked to listen for that.
I like that.
And then
because
they'll
then
recognize
no one's
that.
focused on the cheekbone or the lip per se. They're just, some people are looking at them and think they look better.
Exactly.
The signature feature is enhanced, which is what I usually say. You look at somebody and always try to identify that feature or two, that if there's a little enhancement, just makes them look so much better.
Right.
And better could be rested, it could be more lifted, it could be more youthful.
Right, exactly.
You know, it's sort of a gamut.
Exactly.
The
And
one,
then-
oh, go
sorry,
ahead.
The
go
trick
ahead.
the trick is for us knowing to replace only where they've lost volume, and not
Exactly.
put volume where they didn't lose it. So then they look like themselves, just a rested self.
Exactly.
And that's what our goal is.
Well, that's where the artist comes in. That's where the expertise comes in, because in the patients that get overdone, it's because somebody has put in too much volume or too
Right.
much shaping in an area where somebody's either changed or they shouldn't have that. You
Exactly.
know? So nowadays, there's a lot of fillers that are on the market. What are some of your favorites and why?
In my clinics, I only use dissolvable fillers. So
Okay.
there's a lot of things on the market, and they're great and everything. I just choose to kind of go on to this little bit safer, more conservative side. I'm a conservative practitioner. I always err on the side of safety.
So for the viewers that don't know what that means, what's a dissolvable filler?
That means those fillers are fillers that are made out of hyaluronic acid. They're a clear gel filler. And we have an enzyme in the office that if there's ever a problem, a safety issue or a problem, we can inject it and dissolve the actual filler. So it makes it a little bit safer to do those procedures rather than having a problem that you can't back out of with a patient, that you can't reverse the filler, take it out of maybe an artery or a vessel it went into, which is very rare. But I always like that little edge of safety.
Yeah, and for those that don't know, hyaluronic acid is a sugar that's naturally in your skin. And if for some reason that sugar, when it's injected, you don't like it, or it's causing some swelling, or there's some issues, you can reverse it with that enzyme.
Yes.
Now, I'm a little bit different in my practice because I started out with patients that had HIV, had very severe facial wasting. We needed to use long-term fillers in them because the sugar-based fillers would just disappear. So we were doing, before I even used things like Juvederm or Restylane, I was using fat, silicone, and Radiesse, which is a calcium-based product. But again, I think it's really important that you assess your own practice and what your comfort level is. Luckily, in my hands, I haven't had serious complications, but that's what I wanted to bring up, was we talked about now these sugar-based fillers that can be reversed, but these permanent fillers can't. And if one were to get into a blood vessel or cause some damage into the skin, like an infection or lump or nodule, you really are not going to be able to reverse it. So let's talk about that. What are some of those complications that people need to be concerned about when it comes going to a doctor to get fillers?
some of the complications, probably the most major complication is where we have arterial blockages. So if in fact any of the filler got into an artery, which is very rare, it could block it and block off the circulation to an area above and below where it's being treated. If that happens, we go into kind of emergency mode where we have, most of us should have emergency kits in our facilities that have different things that we would give patients and treat them with to help dissolve it and get blood back into the tissue.
Well, let's actually talk about that, because there's a lot of studies now that say that the filler itself is not responsible for these complications. It's typically a technique approach. So my question, do you feel that that's true? Is it the filler, or is it the technique of the injector that's causing these, or is it just bad luck?
Probably all of the above.
That's what I was going to say.
If it wasn't for the filler, it wouldn't happen. If it wasn't for the needle in the skin, which is the injector, it wouldn't happen. So there's all of the above. But the most important thing, and when I go and teach a lot of this, the most important thing is that the provider know their anatomy, and they know where the danger areas are. And I'm like I said, I'm a conservative provider. I don't recommend going to areas. I say if it makes your butt pucker, don't do it.
Can you tell some of the viewers what are some of those areas on the face that your butt may pucker if a doctor were to put a needle?
Right. There's two areas that we don't allow any of those in our particular clinics, and that is the nose and the glabella. Two areas, and you see non-surgical nose jobs all over the internet right now.
I know, and I'm actually one of those people that show that all the time. And I did do that even on the doctor's show on national television.
Right, and I've done many over the years, knock on wood, not had a problem. But it's a very high-risk area,
It is.
and even for a very good advanced injector, it's still butt pucker. Don't tell me your butt doesn't pucker when you don't do it. So it still is. It still is. So there's little vessels. A lot of the vessels go to the eye. Risk of blindness is high. Risk of causing death to the tissue of the nose is high, and especially the glabella, same idea.
Right.
So it can be done safely, but there's a lot of times when there are complications. And
and I showed a video yesterday in one of our presentations on using something called a cannula in the nose area and around the forehead area that basically is not a sharp end, it's a blunt end, so it can move through the tissue almost like a snake through the tissue that doesn't damage the blood vessels and nerves. But there's always a risk when you're injecting fillers around areas that are constricted, like the nose, you're talking about the glabella area where there's large blood vessels, to where not only the filler can go into the vessel and cause an occlusion or a blockage of the blood supply to the skin, but also around the blood vessel can impinge on the blood vessel, and then that would cause major discoloration and sometimes even what looks like an infection, but it's really scabbing and loss of the skin. Right. And that is something that almost would make it almost difficult for me to go to sleep over the next few months if I know I caused that as somebody who's just coming in for something simple and cosmetic.
Exactly. Every practitioner would feel that way.
You know, it's crazy. So there is some guidelines though, because these dangers have been known for a while, and as we become have fillers that are longer lasting, there's a higher rate of these things probably occurring, such as not just vascular occlusions, but infections and lumps and bumps.
Exactly.
Have you had any of those from fillers?
I haven't had, I've seen them. In our office, we had one late onset nodule, and there's various things that can happen when you do fillers. There's nodules that can happen when you first do them. So the first few weeks you can have a nodule, and that is more injection technique. There was too much put in one area. You can have late onset nodules, which will usually occur maybe a month later, and that's usually after an inflammatory process and somebody develops a bigger nodule that's firm and tender. And there's different treatments associated with those, and there's different reasons why those might occur. And then you've got infections. You can get an infection. There's a higher risk of infection when there's a fanning technique. And then we're learning now that alcohol, chlorhexidine, and betadine, nothing makes the skin sterile. So the skin is never sterile. So it's one of those, it's technique, it's how we assess skin, it's how we treat some of these problems, how we
and sometimes I think it's just frank bad luck, because you can see somebody injecting through makeup for years and never get an infection. And then that person that's so protective and always doing the alcohol and always doing this, and all of a sudden they get two inflammatory reactions. Exactly. So it can just happen sometimes, but the key is that you go to somebody who's experienced, who has very firm knowledge of anatomy, and if something were to occur, they know those guidelines on how to fix them. We talked about using reversing agents to get rid of occlusive problems, or if lumps and bumps forms, being able to surgically remove them or dissolve them with the enzyme as well. especially if there's inflammation and antibiotics and anti-inflammatories. So what tip would you give our viewers about getting filler injections?
I would say probably the biggest, most important tip is you go to somebody who's experienced, who knows what they're doing, who has done it for years, who knows anatomy, and I would say just feel free to ask your provider what their experience is, how long they've been doing this, what products they use, what they do in case of emergency, what areas are safe for them to do, what areas do they feel are not safe. Ask that provider, ask your provider. Keep in mind you're hiring your provider, and if you don't feel comfortable, you can go anywhere you want, and I want patients to know that you're empowered to do that.
Yeah, this is a relationship, you're dating. You don't need to get married right away.
Right.
So you can find a provider that you feel like, you know, you want to date for a little bit and then see if you want them to be your long-term partner.
Exactly.
Lori, thank you so much. Everyone go follow her Instagram and Facebook, Injection Expert. And next we're going to have Gregory Mueller talking about male aesthetics.
Thank you.
Thank you. All right. Okay. So you know that male aesthetics is a hot topic. I did a lecture yesterday. Talking about the trends in male aesthetics, and I'm really glad to have a very good friend of mine here. He looks very dapper, that suit. I almost wore blue today, but today I'm in my black. So I'm excited to have you here. A very experienced surgeon, great person, Gregory Mueller from Beverly Hills, and he has some really specialized techniques. But today we're going to talk about what men want, especially in aesthetics, because he treats a significant amount of men in your practice. Talk to us about that.
Yeah, I went into practice 20 years ago, and as a plastic surgeon, until 3 years ago, I just offered surgery. And then I realized in order to really address the needs of patients, I needed to sort of expand my horizon. So I added lots of minimally invasive sort of approaches for men.
So tell viewers who don't do a lot, because we're in a place where everyone's in aesthetics.
Sure.
You did surgical and non-surgical, and what has become popular over the past few years, you were saying you brought in these minimally invasive procedures.
Yes.
What is that? What does that mean?
Yeah, sure. So as a plastic surgeon, you know, prior to 3 years ago, I just did surgery. So if someone came in, it was either surgery or I would refer them to someone else. Then I realized people aren't coming in asking for surgery, they're asking to look better.
Got it.
So over the last 3 years, I've added laser technology. I use Pro Yellow laser for sun damage. I also use Vanquish to help people sort of sculpt the body non-surgically. That's a radio frequency device. And then also Excelus Ultra, which is great to kind of tighten and tone the skin, and microneedling.
So that's interesting. So, you know, you have a plastic surgeon here who was doing all surgery all the time, which is basically cutting and has downtime. And the trend that he saw was to use devices that people wanted to not have any cutting or downtime just to get an improvement. How is that complementing now? What did that do to your surgical practice?
Yeah, you know, at first I thought it was going to be sort of a trade-off. I'd have to sort of choose minimally invasive and do less surgery, but in reality, it's added. It's added to everything because now when patients come in, I build a relationship with them. They stay in the practice. We can offer everything from A to Z. So it's a more comprehensive sort of program that we offer now, which is much better.
That's great. And I know one of the big areas for you in terms of your surgery is the neck area.
I love the neck.
Let's talk about the neck. So here, tell everybody, because they might not know about your specialized technique. I know you very well.
Okay.
But tell them, because I would love for them to know, so we can kind of talk about the surgical aspect, which you do, which is somewhat non-surgical even, versus what is available without any cutting. So let's hear what his specialized technique is for the neck.
Sure. So in 2006, I came up with the concept of being able to sew the neck muscles underneath the neck without opening the neck. I felt like the surgery was very invasive for someone who had some banding under the neck or some glands that were visible. So I came up with a kit that uses a lighted needle, and the thread's attached to the middle of the needle, and the doctor just passes this needle underneath the skin and can see the light coming through the skin. The surgical kit is called the IC LED surgical system, but we perform a procedure called Elevate, and it lifts the back part of the neck, so it lifts the glands and the muscles here at the back part of the neck, so it's a real great complement to, with liposuction or skin tightening technology.
Which is great because a lot of what he was describing was in the past, the doctors were only able to they had to make a cut either under the chin or by the ear to kind of go under the skin, tighten the muscle and pull everything back. That was pretty invasive. the technology that he developed was using a needle that has sutures or threads on them to lift, creating a scaffold under the skin and lifting the skin without much downtime. That is becoming very popular right now.
Yeah.
And even a little less invasive, the ones that I do, more of the internal threading, are becoming super popular. Why do you think that's occurred?
I think it's the market. I think it's what people want. People don't want to have big incisions and a lot of downtime. People want to be able to get back to work, and they don't want any visible signs of a surgery.
Well, and that's actually what I wanted to bring up, was my leading question to you. Do you feel more men are inclined to want those? Because without having hair to cover scars can be very visible in a male if they've had a facelift, you know, especially if you were to go up into the hairline or around the hair and move it around. Sometimes it's very obvious that a man had surgery.
Oh, absolutely. And men, when they come in, I mean, their biggest concern is, you know, they don't want to have visible scars. And a lot of men, because of the muscle mass that we have and extra soft tissue, the neck is their primary area of concern.
Yeah, I feel like the under eyes and the neck in men are the two places they see aging very early. And then if their family has a lot of laxity and hooding in the eye area, you could have guys in their 20s where their eyebrows are like making it so they can't even see.
Yeah, oh,
and,
absolutely.
You know, so that's where it's interesting. Being a surgeon, you have the ability now to not only do a mix of surgery and or non-invasive, or even somewhere in between, which we didn't really have before.
Oh, absolutely. I mean, I went into practice 20 years ago, and when I went into practice, it was either surgery or no surgery. But now, with all of these other tools, we can absolutely, you know, do a sort of a lower eyelid lift without surgery. And then later on down the road, they may need a surgical procedure, but it's a great way to make people happy. Yeah,
and some of the laser technologies even tighten the skin. I've been using one now called Renuvion for a while, which is a little bit more of an aggressive radio frequency resurfacing technology, but the craziest thing I've ever seen from it is the tightening effect that it gives patients. Yes, it has much more downtime, but it can tighten the under eye to a point where you don't ever need to cut the lower lid, which has a potential, if you guys don't understand, the lower lid area is a very sort of dangerous area to where if you do surgery there, it can pull the eyelid down. It can cause some issues. So doctors always want to try to avoid cutting in that area, and we have a plastic surgeon here obviously is trying to do other things like lasers and skin tightening and or threads to kind of lift that area. What I wanted to ask you is, what is your hottest treatments for men in your practice? I know you mentioned a few, but those were also body. So I'm kind of curious, you know, of face and body, what do you think are the hottest treatments?
I think, you know, for me, just because of my technique for the neck is the #1 reason people come to see me. So that would be my #1 procedure. But I would say microneedling for men, which you would think men would not care that much about the texture of their skin, but I was definitely wrong about that one. It's a huge, huge winner in my practice.
Yeah, that's what I figured. You know, it's interesting. Men, I think, in the past never wanted to have these daily routines. They didn't want to come every month to go to the doctor, but once they start to see the improvement, you get them on skincare, you start light things like microneedling, facials, simple peels. I'm a dermatologist, obviously do all these skin combinations. They start to see that sun damage is reversed. Their wives, their partners tell them they look a lot better and less tired. And at work, they're just doing better because they feel better about themselves. They want to come in. And one of the gateway treatments, I feel like, besides we've talked about Botox all the time for men as being kind of a gateway for cosmetics, but now it's actually, I think, less of an injectable and more of a topical sort of mildly invasive treatment like microneedling. Microneedling was out of favor. People did this many years ago before lasers existed, and was out of favor until recently when a lot of the pens came on the market for doctors to be able to do larger depths for scarring, for stretch marks. Now we're doing it in combinations with lasers. So for example, you talked about yellow laser. I think that's a great photo rejuvenation laser. It could treat melasma, sun damage, and specifically vascular lesions like rosacea and dilated blood vessels. But you combine that with the microneedling for texture, for tightening, for fine lines, you have a very simple procedure in a treatment where they're just red for a day. What man wouldn't want to look better with only have mild redness for a day?
Oh, absolutely. And we combine them very often, and the men love them.
Yeah.
Absolutely, because no downtime.
That's exactly right. So I feel like that's a great. And so my question to you for the neck area, because I always am curious, you are the innovator of treatment in the neck. Where are we going? Where are we going? Are we ever going to get to a place where you don't have to cut?
Yeah. No, it's such a good question. So today we have technologies that will tighten the skin, whether it's laser technology, which I use Smart Lipo for 7 years.
That's what I was going to talk to you
or
about.
something like Face Tight, which is a radio frequency technology that I just acquired, so I'm excited to get started on that. So we have technologies that will tighten the skin. We have technologies that will dissolve fat, things like Kybella, liposuction, different, Thermiva, those sorts of technologies. But where we are going now is there's nothing really that will address the glands and the muscles underneath. So that's the challenge, and that's the technique that I came up with, a way to suspend all of that in a very long-term sort of result area. So that's sort of the area with the neck.
That's actually a good thing, I think, to talk to viewers about. So you can't change your underlying anatomy. If you don't have a good bone structure, you need an implant, or they need to break the bone and replace it and move it around. If you have very, very large glands in the neck, you can lift the skin all you want and remove the fat. You're still going to look like you have wide and you have some puffiness there. So this technique he's talking about, where he suspends the skin with sutures, can also suspend the glands, which is very safe for people, because in the past the only treatment was to surgically remove them. And what's the issue with that?
Yeah, the problem with that is there's a high risk of nerve damage, bleeding, and then also dryness of the mouth, which is not a good thing.
Permanent long-term complications, which people really just don't want.
Yeah, exactly.
So we know that the trends are going to be these sort of minimally invasive small procedures to try and lift and tighten these areas. And that was the next thing I wanted to talk to you about, was the internal tightening.
Yes.
So we went from liposuction to kind of remove fat and help tighten the skin. Then people went liposuction, adding some heat.
Yes.
That was Smart Lipo.
Yes.
So now my question is, what are you going to do? Because you were the Smart Lipo, internal heating, tightening the neck. What are you going to do now that we have Face Tight and Renuvion?
Yeah. So I'm at my technology that I've just acquired is Face Tight. I'm very excited about it. I love radio frequency. I believe in the science. So I will be combining that with the Elevate procedure to lift the glands and the muscles. So I'll be treating the skin by tightening it through a tiny little puncture as opposed to incisions, and then dissolving the fat or removing it with a little bit of liposuction. That's going to be my combination approach.
That's a that's a minimally invasive combination of internal heating, suspension of tissue, and if you wanted to get fancy, you could do some external lasering and tightening and stuff for crepiness and for other sun damage, etc., to get a really full neck rejuvenation.
Absolutely.
What are you gonna call that? That's what I want to know, because you're gonna be the man of a trademark. I already know it.
All right, well, thanks. We currently call it the Elevate procedure,
Yeah.
but we definitely need to come up with a combination name for all three technologies. Absolutely.
Well,
one thing that I liked was when you and I did a case together, I love the fat grafting that you did along the mandibular border. I think that's an area too. You asked me about the neck earlier. That's something that we really have to look at, because in men you want that strong mandibular angle and the jawline.
Yeah, because the big thing I noticed was, everyone was focused on the neck and then they don't look at the underlying anatomy.
Yes.
And if you don't have that structure there, the neck is unsupported.
Yes.
So if you do an implant or you do fat grafting or even some permanent filler, you can get a nice contour, and the elevation makes them look younger much longer.
Yes, absolutely.
Well, Dr. Mueller, I appreciate it. You're one of the best, and I look forward to seeing what you're gonna come up with as we go forward with these advanced technologies. So thank you for thank you for coming.
All right, thanks,
and then
Jason.
You're welcome. Have a great day, and everyone look forward to your lectures. Now we have another one of my very good friends, Dr. Tess Mauricio. Hi, good to see you. You look so wonderful.
Thank you.
Come on
You
over.
too.
And what you guys don't know is she is the women's expert. All the women, the beautiful ones, they all go to her because they want to look like her. Look at her. She's gorgeous.
Practice what you preach,
That's
right?
exactly what I wanted to talk to you about. So that's what my question is to you. So we just went from men. What do men want?
Right.
What do women want?
Well, what do women want? We want everything.
I know.
Right? We
That's
want
the
everything.
thing.
We want to look amazing on the outside, feel great on the inside, and we now have amazing technologies to really do that and offer that for patients. So I'm really passionate about really spreading awareness for all these women's intimate health solutions.
That's good. I want to talk about that because as a dermatologist, we're always focused on what's going on the outside. And then typically those covered areas, dermatologists weren't talking about as much until the past few years when body shaping and these non-invasive technologies and a little bit of a liposuction and some internal heating surgeries became popular. But now we're moving our way down to the down under areas, the genital areas, because women really want to be empowered there when they have kids or when they age, everything changes.
Everything changes, and women don't talk about it because in the past there weren't any good solutions. You know, you're talking about incontinence after childbirth, you're talking about after menopause, there's laxity, there's dryness, pain, and so you know, the majority of patients that we see are women after menopause, and there are millions of women that are suffering silently, and this is why I, as a dermatologist, you know, decided to start offering these treatments, and these are really, you know, safe procedures. We use PRP, which we love for, you know, treating the skin. It makes sense that the growth factors can also turn back the hands of time in the vaginal region and treat these functional and cosmetic issues that women have as we age.
And let's talk about PRP, because not all our viewers are cosmetic. They're not all aesthetic or cosmetic. PRP is platelet-rich plasma, basically a hot topic. 3-4 years ago, when I was asked to lecture about this as the first dermatologist to the American Academy of Dermatology, I was booed off the stage when I was talking about PRP for global rejuvenation because everyone said there's no research on it. But the fact was there wasn't research on it, and how you advance is you try new things, and the growth factors from the basically are drawn from your own blood, and they were used at that time just topically. Now we're finding that if we do things such as inject, and describe that to the viewers, describe what you were talking about, these growth factors can have a big impact on tissue.
Totally, and now it's we no longer argue about it, it's accepted. We're using platelet-rich plasma to rejuvenate naturally your hair, your face, your neck, your hands, everywhere, and now it's going into sexual health and that area. And you know, Dr. Charles Reynolds, who's our friend, the O shot, the Priapus shot, but for women, it's really, I've been doing the O shot now using PRP injected in the vaginal areas for over 4 years, Jason, and it's amazing. The results are almost miraculous as far as improving incontinence, as far as improving dryness, all the issues that we're talking about that millions of women are suffering from, our patients, female patients are suffering from. And the improvement in the quality of life is really immeasurable, because I feel like, you know, we went into medicine to be healers. And you know, when we treat the skin, we know we're healing the soul, but when we treat the vaginal area, I think it's a different kind of elevation of the spirit.
100%. People's lives are changed when you change how they feel about themselves. Obviously, if you change their skin, the way they look at themselves makes them better at their job, makes them have a better relationship and stuff. But many people suffer from having lack of sexual desire, sexual satisfaction, the inability to orgasm. And I know these things are things people maybe didn't want to talk about for a long time, but these are now coming to light. And this is what you're really doing for people. If you follow her social media, you will see the significant number of people that are just saying how much she has changed their lives all the time. They may not say the procedure, this may be one of them, but you're focusing then on their long-term longevity.
Yes,
their satisfaction of life.
And this is our goal, right? Like I said, when we went into medicine, and now, you know, how many times have you talked to your patients about their problems and they're in tears? One, because they feel it's hopeless, you know, the problem is hopeless, and now you turn that hopelessness into, like, you know, their hope, and they're excited about life again. This is what we can do now with women's intimate health, and now we have all these amazing energy-based technologies. That's
what I was going to talk about next.
In addition to platelet-rich plasma, and we love combination procedures, and we have in our office what we call the V-Time Machine, because we do the time machine on the skin. So the V-Time Machine is combining energy-based treatment, whether, you know, it's a CO2 device or an RF device, to treat the vaginal canal, the external, you know, vaginal anatomy, and then treat it with PRP. And one, it cuts down the downtime and it increases the efficacy of the treatment, and it's amazing, Jason. And you can imagine if that works here on our skin, it will work that well for
I always tell people, if you're dehydrated here, your lips are dehydrated here, your lips are going to be dehydrated down here. So after having kids, it may be loose. After having, you know, menopause, it may change the look and the feel of the skin in that area. So by doing the heating treatments, by doing lasers, by doing the PRP injections, there's a lot that we can do to get improvement there. And I think that there's going to be more treatments coming up in the future. And you have to follow Tess because she's going to be one of the ones that are going to come up with the newest things.
Well, you know, it's still not being talked about by the media. It's interesting. You get all these commercials for erectile dysfunction, but when you're talking about women's health issues, intimate health issues, urinary incontinence, dyspareunia, pain, I can't even talk to the media because they said that's vulgar.
I know.
So I really feel that the physicians that are here right now at the Aesthetic Show have the power to educate their own patient population that these amazing treatments work. And let me talk about regenerative therapies as well, because if PRP and the energy-based devices are not working, we now can access, you know, fat as a source of stem cells, and that can also be used in the vaginal area in combination or alone to rejuvenate that area amazingly.
Yeah, it's unbelievable. There's so many advanced technologies now. Thank you so much, Tess. You're
Jason.
Wonderful. It was good to see you again. So that was Tess Mauricio talking about women's health. We're now going to bring up Deepak Dugar to talk about understanding the millennial patient.
Hi, how are you?
I love that he's here for this with me because I feel I'm one of those very significant influencers to the millennial patient. So he's going to have very good answers for my questions today. No, I'm kidding.
Yeah.
So thank you for coming. What are you lecturing on here at the Aesthetic Show?
A couple of mostly fillers, and then I'm doing a lot of lectures on millennials and my rhinoplasty practice.
Yeah, and if you guys haven't followed him online, you need to. What's your Instagram handle?
Deepak Dugar MD.
Perfect.
And it's all rhinoplasty stuff.
You need to follow him because his nose work is unbelievable.
Oh, thank you,
But what the point about that is that his documentation of that, the pictures, the videos, is hitting our millennial patients. Now, people think that social media is just young patients, and it's not. If you went to my lecture yesterday, I talked about the fastest growing populations are ages 20 to 30 and 65 and up. A lot of patients in their 60s on are looking for something new. They want rejuvenation. They want something different. They're looking for these young guys like you and I that are making an impact. So describe to me, how do millennials do their research and how are people doing research now for doctors?
Yeah, absolutely. So it's changed a little bit. Before, you know, typically it was all physician referrals and friends and family, and that's what everyone was guided based on. Now, they did a study recently, and they showed that the #1 source of finding providers was Google. Number 2 was physician referral. Number 3, friends and family. Number 4 was social media. So social media is up there now. It's not something that's not ignored. It's something that's really important now, and we all know that, of course.
I mean, if somebody asks you, do you know this? I say, no, Google it.
Yeah, exactly.
Just look it up. Like, this is what we do nowadays. I can't even live without my phone. Soon you're going to tell like a contact in your eye or something in your brain to just do it for you. And it's just going to do it and send you the information.
We're in the world of Amazon. Yes, exactly.
But still, and we did talk about this too, that referrals, local advertising, local reputation, and referrals from other patients is still the most important, but you have to build that reputation first.
That's right.
So if somebody doesn't know you, how are they finding you and then wanting to go see you?
So usually patients are finding me because of another patient's happy results or satisfaction, and that they tell their friends, hey, I'm so happy because of so-and-so, go check them out. They'll go online, find out about me. So usually they find out me on Google or one of their friends tells me it.
And then on your social media, what do people comment that they see that they love?
For me specifically, I do very subtle nose jobs. I do what's called a scarless nose rhinoplasty. Everything's from inside, no external cuts. And they love that because I do very minimal changes. I don't do drastic nose jobs. I don't do reconstructive nose jobs. I do really finesse, subtle changes. And so a lot of people want that. There's a whole population that wants subtle changes. And so because of that, they find me.
I love that answer because in the past, doctors are now seeing the issues that occurred by taking out too much cartilage, by breaking the bone and making it too small. They're getting nasal valve collapse, difficulty breathing, pig noses, very small tips that have collapsed and stuff. By doing a conservative approach like you would take, you're keeping the nose natural, and as we age, things shrink and kind of cave in, preventing that from occurring at an earlier age.
Yes, that's right. Yeah, the old technique was what's called resective rhinoplasty, where they would reduce the nose. Now we're doing a more conservative approach where we're trying to build it up / preserve as much as we can.
Yeah, it's very interesting because a lot of the reconstructive doctors or even even some of the primaries are doing grafting.
Yes.
They almost make the nose bigger, but it's
Yeah.
reshaping it.
Exactly.
Contouring, just like we do with fillers. Because I have patients that have round faces, and I do fillers on them, and they say, I don't need fillers, I have round face.
Yes, that's
I
right.
said, but to create a heart-shaped face, we need to lift here,
Yes.
project there.
Exactly.
So by elevating the tip or elongating or softening in certain areas, you get
That's
what you
exactly
get is
right.
your camouflaged conservative look, which is great.
That's exactly right.
We had another topic earlier talking about liquid rhinoplasties.
Yeah.
How do you feel about those?
I think that when done appropriately, they're really, really amazing for patients because a lot of people don't necessarily want to get surgery.
And that's a very big millennial thing. That's why I want to ask.
Huge millennial thing.
They want to avoid having surgery, so they want to go to fillers because
Yes.
all the celebrities are getting fillers that they know about.
That's right.
So is everybody a candidate for liquid rhinoplasty?
Absolutely not. Absolutely not.
So who is
the biggest
not?
point. So I would say most patients who are post rhinoplasty, you have to be very careful of, especially if you are a novice injector or you're just starting out. Be a little careful. If you're as experienced as Dr. Emmer, it's different. You can handle almost anything. But the average novice injector, be careful of revision rhinoplasty patients. Be careful of injecting on the lateral sidewalls and on the ala. Those are really dangerous areas, highly vascular, you know. And you know, Dr. Emmer and I do a ton of these, so we understand the anatomy really intricately. But the average novice injector, be very careful and cautious about it.
Yeah, because you know sometimes we were talking earlier, it's injection of a filler into a blood vessel. Sometimes the blood vessel gets a pressure, it gets compressed, and sometimes it's just bad luck.
Yes.
Someone doesn't have great anatomy and it goes somewhere and it just happens and you have to, you know, avoid those consequences. So what do you think are the key needs? What are the millennials looking for when it comes to a surgeon?
I think that they are looking for low downtime. They want no telltale signs of surgery. They want the quickest recovery possible, and they want it immediately. They don't want to wait.
It's crazy.
Yeah, it's not the old days where you book surgery 8 months in advance and you say, okay, I can't wait till next summer to get my surgery. They want it next week. I have patients who call me from Europe and they say, do you have availability next Thursday for surgery? I was like, well, have you even bought your flight yet?
I know. This is why myself work about 16 hours a day and some weekends because I'm always having to add surgeries all the time.
Exactly.
I got emails yesterday asking for 4 surgeries next week.
Exactly.
I'm like, this is almost impossible. It's unbelievable that the millennials want that instant gratification. It's because of a lot, in my opinion, these social media seeing immediate results with low downtime procedures, which we basically just talked about. He does and is very successful. So I think it's really important to, you know, follow social media and see how things are trending. What do you think is the newest trends upcoming in cosmetics for millennials that millennials would be interested in?
Yeah.
Because I think 2 years ago was lips.
Yeah.
Then it is butts. Now it's jawline and chin. What's next?
I think what you're doing is the newest trend. I think people want high-def sculpting.
I
think
agree.
people are
Body
all about
shaping.
the body shaping. I think it's the #1 thing that everyone talks about and asks about, and I think you're right on the target.
Yeah, I think body shaping is going to be is probably where it's going right now, but noses are always going to be there.
Always.
Never going to change. There's so many noses.
It's the #1 surgical procedure age 13 to 19, #2 surgical procedure age 20 to 29.
Well, I really appreciate you coming here. This was great.
Yeah, thank you
It was
so
a
much.
pleasure. Everyone follow him on social media and get ready to see his great lectures at the conference.
Thank you so much.
Thank you.
My pleasure. Thanks for being here. All right, thank you.
Well, I feel very lucky today to have one of our favorite company representatives. I don't know how to describe you. How do we describe you?
I am a practice management consultant.
Practice management consultant. Tell everybody where you're from and what you do.
Absolutely. So my name is Mara Shore, and I am with Shore Solutions. We're a practice management consulting firm. We work with clients in this particular space all throughout the country.
And the best part about this interview is I'm the one that's going to be interviewed today.
Yes, we're going to turn the tables.
We're flipping the table here. Why are we doing that?
We ultimately are doing this because we want you to be the opportunity to have the opportunity to tell us about NeoSkin by Airlace. So
I'm very excited about that.
Tell me more about the product. Tell me a
will.
little bit about it.
So for those that don't know me, and I know you guys have been following, my name's Dr. Emmer, and I have a practice in Los Angeles that has probably some of the most lasers in all the United States. We have right now currently 63 devices in our practice, and we do a lot of clinical trials. And a couple years ago, company Airlace came to me with a laser device that said, we need to get this in your hands to see what this can do. Because they knew that it was successful for various reasons. This device, which is a 1064 wavelength, which, if for those that don't know what that means, that's a deep penetrating laser, in the past would burn the surface of the skin and be very painful. Think about it, if it goes deeper, it needs a lot of energy.
Right.
It's painful. But this laser is unique because it's so fast pulsing that it bypasses the upper level of the skin. So quick pulsing that the energy at the upper surface doesn't even get absorbed. It absorbs below to certain chromophores like the hair follicle, blood vessels, and pigmentation. So with that said, I was like, this is interesting.
Yes,
you know, this is a very cool
absolutely.
device, but I didn't see anything happening. You like look at it, nothing happens. Because in the old days, the lasers, you hit it, it burns. The
Yes,
skin burns.
absolutely.
There's a change. With this laser, it's just a little red. It's like almost nothing happened because all you feel is heat.
Right. So what have you seen having this in your practice now? What has that meant for your patients? What kind of results have they seen?
It is completely life-changing.
Okay.
I'll tell you, every patient we have gets some sort of Aerolase NeoClear treatment in combination with something else, because this not only targets blood vessels, so if you have underlying redness in your skin, it gets rid of it in a series of treatments, and then you can maintain it with your monthly facials. It gets rid of pigmentation, really stubborn melasma that everybody knows can come from hormones after having kids, frank bad luck, Hispanic background, that can just happen. How do you break apart that pigment without stimulating more pigment? Because
Yes.
you know, patients that are sensitive to pigmentation, it's lasers and heat that can cause it. So you would think a strong laser would rebound,
Right.
but it doesn't. It
Right.
actually breaks apart that pigmentation, and in combination with other lasers and peels, you get a really significant outcome. The best part is the treatment for acne.
Okay.
And that's
Tell me
where I know we
about
talk about
that.
NeoClear. So if you're using this device in a way where you globally heat the area of acne and then independently treat the cysts in another way, you do the NeoClear treatment, which gets you a very big improvement in acne without any visible signs of change to the skin.
Okay.
And you know, with acne, there's scarring, there's pigmentation.
Yes.
So this also helps prevent that by getting new collagen formation, by decreasing the redness that occurs after acne. Every one of our Accutane, every one of our acne patients are getting this treatment every month.
And what sort of downtime is associated with this?
Well, that's the unbelievable thing. With this laser, because it's bypassing the upper surface of the skin, there's
Yes.
literally no downtime. You do feel a little bit of heat, and with more passes and very more targeted treatments to large cysts or blood vessels, you can get some redness to the area, but there shouldn't be any scabbing, there shouldn't be any crusting, mild swelling, which we can get improved with ice packs or LED therapy, red light therapy, Claritin, like an antihistamine, but in general, there's literally no downtime. So to me, this device is something everybody should have in concert with their other treatments. So what we do in our practice is, whatever laser you get, we add it in. You're just gonna get it because it's gonna improve everything. If you're getting peels, we want you to get Aerolase. If you're getting Fraxel and you have some redness, you need to get that too. So it's in combination with almost everything we have. The other thing I didn't talk about is its use in scars.
Okay.
I have a lot of burn patients. I was trained in the laser fellowship, so I have a lot of patients that have severe burns, post-inflammatory hyperpigmentation damage from chemical burns and fires and accidents and such. We have used this device in concert with other lasers to break apart thick scar tissue. Hypertrophic scars, which are those large, thick, pink, purple scars, you can use them. But remember, this is deep heating, so if you're not careful, you can then get blisters in those areas. So in general, it's really a no downtime procedure.
Right.
And my acne patients are young.
Right.
You have young
Yes.
patients coming in and getting this done, and their acne improves. Now they want skincare. Now they want to do microneedling. Now they want to do peels. And you're going to see what's going to happen with our age. There's going to be age shift as we age because the young patients are getting lasers.
Yes.
They're going to look so young as they age.
And it's helping them move through the life cycle of your practice because
Exactly.
it's turning them on to other treatments as well.
So it's really one of my favorite treatments.
Awesome.
And I really think it's something that all doctors should know about, should learn about. 1064 microsecond technology, because it has literally no downtime.
And can you tell me a little bit more? I understand there's no consumables, so can you tell me a little bit about the financial benefits of having this in your
Yeah, I think
practice?
to finish it up, I think for
Yes.
doctors, it's important that you get a device that has multiple uses, so you can use it for different areas of finances in your practice. With this device, there's literally no consumables. You're not paying to use it every time. You're paying once you get it, and that's it. And so to a doctor, it's an initial investment, but there's so many areas that you can be using this. Hair removal, blood vessel improvement, rosacea, acne, scarring, rejuvenation, just to improve pigmentation and wrinkles, and there's no consumables. So to me, this is a no-brainer. That's why when it initially came in, I wanted to try it, but then quickly I was like, look, we need to have this device no matter what in our practice. We do it for everything. My estheticians we always add it on to our facial treatments. We add it on to every laser treatment. We use it as a primary treatment for those that have acne, scarring, and melasma.
Thank you so much for sharing that information. It's always great to hear
about what's coming out. Thank you for interviewing me today.
Yes.
This was great.
Yes, it was lovely to spend this time with you.
Thank you.
Absolutely.
So that was Aesthetic Show Live. I think it was a great show today. Stay tuned for more great advances at the rest of the Aesthetic Show this week.
If you hold this, I can give you...